Hello, I'm Patty Pellikka, Editor-in-Chief of Journal of the American Society of Echocardiography. Welcome to Author Spotlight. I'd like to call your attention to an extremely interesting paper in the March issue of JASE. This paper is entitled Incidence of Severe Adverse Drug Reactions to Ultrasound Enhancement Agents in a Contemporary Echo Practice. And I'm joined today by the authors, some of the authors of this interesting paper, Dr. Mays Ali from Mayo Clinic, Florida, and Dr. Jeremy Thaden, Mayo Clinic, Rochester. I'd also like to point out that we had a guest editor for this paper. Dr. Thomas Ryan from Duke University was the guest editor because the paper is from Mayo Clinic. So, Mays, tell me, what led you to look at this topic?
Yeah, this kind of happened fortuitously for me as a fellow rotating through the Mayo Clinic Rochester Stress Echocardiogram Lab. As we can imagine, use of ultrasound enhancing agent plays a critical role in stress echocardiography for identifying endomyocardial borders. And so we use it very frequently. And when I was a fellow, actually, we had a situation where a patient had an adverse reaction to ultrasound enhancing agent. She became unresponsive and developed ST elevations and then pulseless electrical activity, prompting advanced cardiac life support, intubation, and hospitalization. And so when this happened, we have a system in place to report adverse events, and we chatted with the director of the Echocardiography lab, and the decision was made to have a meeting moving forward. And it was actually during that meeting the following week that there was another adverse event of a patient receiving ultrasound enhancing agent, this time during a bedside echo. And so having two events occur in a short time frame prompted us to kind of talk amongst ourselves and think about other situations and other adverse reactions patients may have had either recently or remotely within the Mayo Clinic system. And then when we talked to other providers, we realized that this wasn't an isolated occurrence. And that prompted us to think a little bit more broadly about, well, we have a database and we've had this experience here, and all of us are really committed to patient care and patient safety, especially in the echocardiography lab. And so we decided to explore it further and delve into our data. And that's kind of how it came to fruition.
And it's an amazing amount of data that you collected. This was a multi-center effort. And Jeremy, tell me how you managed to pull that off.
Yeah, so that was also fortuitous. So we I think, as Mays pointed out, we had been wondering about an uptick in adverse reactions for a number of years. But there were a couple of fairly more serious reactions that I think made us realize we should review our own experience. Through ASE, actually, at the scientific sessions and a couple of contacts that I had through common committees, we realized that actually there were a few different institutions that had also noticed a similar, at least a perceived uptick, and so. Because these are still rare reactions, having a larger statistical power was quite helpful, and to see that if there was a common theme from institution to institution was very helpful. So we actually made met up with a few contacts through ASC and committees, and then one of the institutions actually was the contact was one of our trainees. Had experienced this at one of his prior institutions, so it was all sort of a little bit coincidental and fortuitous that we all met up. So
all part of the Echo family.
All part of the Echo family. That's right. Yeah.
Has this impacted our use of ultrasound contrast agents in the Echo lab?
So I think that what I would emphasize is that. Echo enhancement agent is incredibly important and helpful. It helps with diagnosis in so many different conditions. So I think our indications for use have not changed. So we use it in all the same indications that we would previously. But I think what it has helped us to recognize is that these reactions were a little more common than we thought they were. And some of them present in atypical ways. Some of them can be very quick after the infusion of the enhancement agent, and they may not have typical allergic symptoms in many cases. And as Dr. Ali pointed out, they can be quite dramatic. So this is something we've known for a long time. I think what was surprising to us is they were a little more common than we'd previously thought, and probably increasing in frequency in more recent years, which has prompted us to sort of, again, be aware of the reactions and educate our staff on how to effectively deal with them. So,
well, thank you. Yeah, to encourage all our readers to check out this interesting paper, and also the excellent editorial written by Dr. Brian Davidson from Oregon Health and Science University about seeing the smoke and seeking the fire, pharmacovigilance in the post-pandemic era. There's another interesting article in the March issue of JASE, and it's about the potential for reducing the incidence of minor side effects by avoiding use of a flush when an ultrasound enhancing agent is used. So check that one out too. That's by Dr. Harold Betcher and colleagues. Thank you.